Hello and welcome to Mother Tongue, the podcast where modern motherhood meets real life. I'm Marianne, founder, podcast host, and mum of three, and I created this space for all the mums who are juggling it all. From toddlers and tantrums to businesses and burnout, we're talking about what it actually takes to build a life, a career, and a family all at once. Here, you'll hear honest, unfiltered conversations with founders, freelancers, experts, and everyday mums about work, wellness, identity, mental health, relationships, and everything we carry that no one talks about. Hit follow, join our community, We Are Mother Tongue, and tune in for real talk that supports the whole you, because modern motherhood is busy and no one should do it all alone.
We are so incredibly excited to welcome Dr. Sunita. Dr. Sunita, how are you? How was your summer? Have you been working the entire time?
I had a few breaks in between. Well, yes, more or less. Yeah.
More or less here or there. We're talking about a very important topic today, and a topic that is actually very, very close to my heart, because I think after 3 kids, I can very safely say that postpartum does not suit me. And my mental health always takes a real battering, especially in those kind of first 4 or 5 months. Today, we're talking about maternal mental health and why it's so important. And can you just start by telling us, firstly, why you got into this profession? And secondly, why do we need to take mental health in this day and age really very seriously?
Okay. Why I got into this profession is a very story that goes long back. I read a few books, watched a few movies that really made me interested in mental health. And so while I was doing my medicine and while all my friends were thinking about surgery and medicine, I was thinking about psychiatry. And of course, I was trained in India to start off with. So mental health is not big in India. It's changing.
Yeah.
It wasn't very big when I was training, and everybody was trying to dissuade me from going into psychiatry. Here I am.
Well done. Well done. Well done. I mean, you said this, and I think it's very, very much the same in England. You know, people weren't into mental health 10, 20, 30, 40, 50 years ago. It was just not something that was talked about. And there was almost a certain shame that came with mental health as well. If you said you were feeling anxious or depressed or anything else, you were almost singled out as being, there was something really wrong with you.
Yes.
Whereas I think one of the beauties about social media, and they're, you know, it's very high level in my opinion, social media. But one of the big things is that people are now more open about mental health. It's become more normalized. And I think in any way, shape or form, someone has dealt with mental health issues at some point in their life.
Absolutely.
And I definitely have. But why is it so important? Why do we need to be openly talking about mental health?
So I think maternal mental health is a very important topic in this day and age. No longer are we in the age where we are thinking that everybody goes through this and you should be able to go through this as well. Maternal disorders, mental health disorders are very common in the peripartum period. Peripartum meaning pregnancy and postpartum. So when you deliver, up to 1 year after delivery, that whole period is called the peripartum period. And mental health disorders, unfortunately, are very common. Depression, anxiety, intrusive thoughts, but far more seriously, psychosis, which is fortunately the rarer one. But they are so common, and they are by far the highest cause of mortality, even in mothers. So it is something that is not talked about openly. There's not enough help offered. And I think starting a conversation around this is very, very important.
I agree. I really do agree. Because I remember when I had my first child, and for me, I've got a boy, an elder boy, a middle girl, and a younger boy the youngest is now 7 months old. And for some reason, the boys seem to affect me way worse than the girls. I don't know whether it's the hormones, the testosterone, I don't know what it is. But I remember when I had my first intrusive thought when my little boy, my eldest, was about 4 or 5 months old. And I genuinely was like, someone is going to have to put me into a mental asylum. I was like, I don't know what is wrong with me. It was bizarre. And I was so afraid of my own thoughts that I refused to talk to anybody about it. And for so long, I just buried it so deep because I was just like, this isn't normal. I've never heard of anyone experiencing anything like this. I think there's intrusive thoughts from, what happens if I fall down the stairs with my baby? But my intrusive thoughts would go from what happens if, I crash my car through to what happens if I'm a lesbian, or what happens if I want to start eating people. Like, it was so wide ranging. And I was like, oh my gosh, what is going on? And finally I reached out to someone for help, and they were like, yeah, no, that's an intrusive thought.
Yeah.
About 70% of women during postpartum experience this.
Yeah.
And I know the percentage is very high of women who experience, you know, kind of the anxiety, depression, intrusive thoughts. But what about psychosis? What percentage are we talking about here? And what is the difference between, you know, anxiety, depression, etc., and then psychosis? Like, if someone is going through psychosis or entering into psychosis, what are the main differences between the two?
So anxiety and depression symptoms can overlap. The anxiety definitely can also be present in psychosis. But let's talk about the anxiety first.
Yes.
So anxiety is this constant feeling of apprehension, impending doom, something bad's going to happen, worries, lots of fears about your ability to look after the baby, worrying about the baby's health, worrying about your own health, worrying about just about everything. And this can affect you feeling restless, you feeling unable to concentrate, and you can have panic attacks. So panic attacks, I think a lot of people know what panic attacks are, but basically intense anxiety, and you have palpitations, breathlessness, shaking, you might be sweating, may have blurred vision, dry mouth, and all this can be triggered within minutes and leave you feeling very shaky, as if you're having a heart condition or you're going to die. So very scary. So that is anxiety. Depression is more about low or irritable mood.
Yes.
Loss of pleasure or interest in things you used to enjoy before. Feelings of helplessness, hopelessness, worthlessness, and also guilt, right? Losing your confidence, losing motivation, right? And in both these disorders, you can have more serious symptoms like feeling you want to end your own life, or you want to harm the baby, or the baby is better off without him. And so those are far more serious symptoms.
And would be more on the psychosis side.
So yes, that would probably be a little bit, can be, but it depends on what else is happening and how bad they are. So that's the anxiety and depression. With psychosis, you lose, basically the definition of psychosis is you lose touch with reality.
Okay.
So you start feeling that there is something seriously wrong.
Yes.
And you might be hallucinating. You might become suspicious of things happening. So that is more like a psychotic, like a schizophrenia kind of psychosis.
Yes.
But you have other psychosis like manic psychosis. So manic depressive psychosis, the symptoms of mania would be feeling very high, feeling on top of the world, like you can do anything in the world.
Yes.
It's, you're spending a lot of money, you're running, doing a lot, you're not sleeping at all. So it can be a manic type of psychosis, but it can also be a depressive type of psychosis. So the depression can be so bad that you start thinking you're the worst mother ever, you've committed a big sin, you're guilty of a lot of things, and you deserve to die, and you're not fit to be a mother, and the child is better off without.
And does psychosis start in a more like gradual, like anxiety and depression, and then kind of goes into the more psychosis state, or is it something that is quite obvious psychosis from the start?
It could. Anxiety usually doesn't translate into psychosis.
Yeah.
But depression, like I said, yes, you can go into depressive psychosis. But sometimes it's obvious from the start.
Yeah.
Yes. So it's a different illness to anxiety and depression.
I want to bring it back to the beginning to pregnancy. Let's start with prenatal mental health. I have met a lot of women who suffer mental health postpartum, but during pregnancy, not as many. Is pregnancy mental health something that it's very common? And if you suffer from mental health issues during your pregnancy, are you more likely to have issues postpartum too?
So now we know. So the criteria and the classification keeps changing. And previously it used to be 1 month post-delivery.
Okay.
Used to be the criteria.
Okay.
But now they have widened the definition to say peripartum.
Yeah.
So anything to do with the the antenatal and the postnatal period.
Yes.
Everything is included.
Okay.
Definitely depression and anxiety seem to be, and inclusive the OCD.
Yeah.
All seem to be more common prenatally
Okay.
and natally, but it also depends on whether you've had it before. So if you've had a mental illness before, anxiety or depression before, you're far more likely to get it when you're pregnant, because hormonal changes are acting on an already susceptible brain,
Sure.
right? And you're more likely to get it.
Okay. And what is the process then if someone is suffering when they're pregnant? I mean, medication is obviously something that helps a lot of people, but can you give certain medications to pregnant women? Like what is the normal course of action if someone is feeling anxious or depressed during their pregnancy and they come to see you? What kind of help can you offer them?
So when anxiety and depression, fortunately, they are very similar illnesses and the treatments we use are very similar.
Yeah.
But basically you can offer medication. So the medication we usually offer is called an SSRI,
Okay.
which is a selective serotonin reuptake inhibitor, and it increases serotonin in your body.
Okay.
Okay. And these medications have been around since the 1980s. Prozac is the most famous one.
Okay. Yeah.
And we have a few others as well.
Mm-hmm.
Right? And so this is usually our first choice, but a lot of other antidepressants and things we call mood stabilizers, specifically antipsychotics, which are used as mood stabilizers.
Yeah.
Generally, as a class, mood stabilizers are not that safe in pregnancy, so we tend not to use them.
Yeah.
Okay. But we can use antipsychotics as mood stabilizers. So these two classes of medication, antidepressants and antipsychotics, seem to be reasonably safe in pregnancy. We are not just giving medication. When a pregnant woman comes to me, we are having a big long conversation.
Yes, sure.
About what's happened before.
Yes.
What medication has helped them. Are they still on medication? How bad is their illness? So if they're having illnesses again and again, if they're having depression again and again, then we are going to be thinking about not stopping the medication during pregnancy. So you're basically looking at the risks of untreated illness.
Yes.
Versus the risks of taking medication. And then you're going to try and balance that. But if people don't want medication, or if the illness is mild and they've had it before, but it's not been bad and it's not happened again and again, then you probably think of therapy. You could think of something called transcranial magnetic stimulation, TMS.
Okay.
Which we are now offering in the Bite and Small and in Data Mediclinic. So we are offering it in 2 cases. And worst come, if the illness is very serious and you don't want medication, we can think about something called ECT, which is electroconvulsive therapy.
Can you tell me about these 2 therapies? The one that you've now got at Dubai Hills Mall and in, where did you say? Dara.
Yeah. Okay. So we haven't got the 2 therapies. It's only transcranial magnetic stimulation.
Yeah.
ECT, some of our psychiatrists do it. So Dr. Shree does it in Mediclinic Middle East.
Okay.
So he does ECT.
Yeah.
But TMS is transcranial magnetic stimulation.
Okay.
So it is non-invasive. The patient can walk into the clinic and walk out. It's a treatment that lasts around 40 minutes. And it's basically a magnetic coil which we place on the patient's scalp after having measured the scalp to see where is exactly the right place to put it. And that then transmits magnetic impulses into the brain and changes the plasticity of the brain. So,
wow.
Yes.
Wow.
So it's relatively new.
Yeah.
But definitely in Mediclinic, it's new. So we only started, I think, 2 months ago.
Wow. That's so interesting. So interesting. I've never heard of that before. Just coming back to obviously pregnancy, hormonal changes are wild, as we all know, during pregnancy and postpartum. Is there a line for you versus someone who is experiencing hormonal changes and might be feeling a little bit of anxiety or a little bit of something they're not used to, versus when it's actually something that really needs to be treated? Like, is there a set of questions that you ask that will define, yes, you actually do need a little bit of help, or no, this is just the first trimester and your hormones will balance out and you'll feel a bit better soon? Like, is there a difference?
It's very difficult to tell whether these hormonal changes or not. And unfortunately, we don't have any biomarkers, blood tests, etc., that we can do to find out, is this hormonal? Is this something else? So the science is not there yet. So we don't differentiate between hormonal changes and depression that is or something else. So we treat it the same. We assess it in the same way. So yes, but we will be looking at how serious is it? Does it need treatment? Can we do counseling? Can we do therapy? Can we avoid medication, especially in the first trimester? And or if the woman is trying to get pregnant, because of course, at the time you realize you're pregnant, it's 15 days at least.
Yes.
Before you realize that I'm pregnant. So
Yes.
obviously the baby has been exposed to the drugs, and that's your first trimester. So first trimester is when the baby, obviously the organ, the baby is forming, key things are happening. And you don't want to disturb that. So if we can, we avoid medication in the first trimester. Worst come.
Yes. Okay.
And start again in the second and the third trimester. And
Okay. Interesting. Now, baby blues. Baby blues is a word that's battered around a lot. And again, for me, I never felt the baby blues in the sense that it was the first month, 2 months, I felt relatively stable. It was actually after that month 3, month 4, month 5 that really hit me, that I was like, whoa, this is spicy. What is going on here? But what are baby blues? Because baby blues are, in general, not something that should be a massive concern.
absolutely.
But there is a period. And what are the baby blues? What's the definition of that?
So baby blues are basically, we call them postpartum blues. And they basically start within around 2 to 3 days post-delivery. They are mild. The mother may feel tearful, may feel anxious, may feel a little low, but it doesn't affect her functioning. It doesn't impair functioning. It doesn't cause distress. It's not something that's constant. The symptoms are not constant and they are not severe, right? So just a small range of symptoms and happening over the first 2 weeks. I mean, when you've had a baby, there are so many.
I know.
You're not sleeping, you're bleeding, you're healing, you're breastfeeding. There's just so much happening. It's such a huge period of adjustment. So I think 2 weeks is fine. So basically, that's the limit. So we say 2 weeks to adjust. And if symptoms persist beyond 2 weeks, then we start thinking along the lines of postpartum depression, postpartum anxiety.
And again, so we've obviously talked about the medication side in pregnancy, postpartum depression or postpartum anxiety. Again, what are the roots to this? I'm quite happy to talk about what I've been put on, because again, so I'll talk about this first, and then if you could maybe share some insight on other options. I was put on Zoloft, which I believe is very common here for anxiety. What I was not aware of is that Zoloft, when you're adjusting to the medication, can send you through a loop. And they did say you might get worse before you get better. But the worst was, wow, I was literally like, well, we are really losing our mind. And then it was literally one day, I think it was day 4 or 5, something switched and I felt so much better. But that's quite common with anti-anxiety medication, isn't it? And finding the right one that works for you is also quite difficult.
Not necessarily.
Okay.
So Zoloft is sertraline, and it is by far the most researched, studied drug in pregnancy and postpartum. It is very safe. It is very good. Yes, as with any other medication, you may have side effects. And the side effects are usually the first 2 to 3 weeks of taking the medication. As the body gets used to this, is one of the drugs called SSRIs. So they release serotonin. But as the body and the brain gets used to this higher level of serotonin, the symptoms subside over a period of 2 to 3 weeks. And I always tell patients that to expect this. And the more common side effects are nausea, vomiting, gastrointestinal side effects, anxiety, this word, way word. So it can feel like you're getting worse. But actually, it starts kicking in 1 to 2 weeks. For anxiety, it always takes longer, and we may need higher doses. So anxiety is always harder to treat. And so, very hard to tell you.
I just need to try a personal session. I love it. I will, don't worry. I will be coming to see you. But for people who are clearly suffering, but they're not on the far end of the scale of like really desperately need help. Let's say they don't want to take medication. What would you say? What are good things for people to try and do to make themselves feel less anxious or feel less low?
So I think it's very important to garner support.
Great.
Ask for help.
Yeah,
I did that when I had my first one and I was struggling. And I asked for help. I asked my friend to come and take me because I was getting so anxious about leaving the house. Definitely ask for help. Offer help if you can. Exercise is a good thing. If you have, if the lack of sleep and the tiredness and everything you don't get into, exercise really helps lift mood, gives you some me time, gets you out of the house. Even if you do it in the house, it still affects.
Yes.
So exercise is definitely a good thing. Garnering support around you, accessing groups, maybe online, maybe not antenatal classes, but if you're in the pregnancy period, yes, antenatal classes or groups specifically for parenting classes, stuff like that. And you socialize, you meet people, right? You mix, and you discover that everybody's in the same mood as you, which makes you feel a whole lot better. Yeah, you're not the only one suffering, right? Talking to your family,
Yes.
talking to your professionals.
Yeah.
Yes, it's really important. And if you're really, really concerned, then go and see a psychiatrist or a psychologist or a counselor.
Yeah. I think that is really important. And yes, that's something that, again, I think there was such a massive stigma, 10, 15 years ago around therapy. But the analogy I always use is you wouldn't ever not service a car because obviously the car would end up just crumbling, being relatively useless. Why would we not service our brains? I think that it is therapeutic to have therapy.
Yeah.
And it's been one of the biggest game changers I've done. I mean, I go every 2 weeks pretty much religiously. And it's a break for my brain. It's an outlet for me to just settle. And it's great. I think it's wonderful. The other thing that I think that's really helped me, and I'm more on the ADHD side of which fuels all the anxiety and everything else, is caffeine. I feel like if you drink a lot of caffeine on an empty stomach, that never helps.
Yeah.
If you are a coffee drinker, and I understand that parents are sleep deprived and caffeine is essential, but have caffeine with some food. Don't have it first thing in the morning on the empty stomach. I preach and I don't quite do yet, but I feel like starting your day with something other than caffeine definitely helps reduce anxiety. Sure.
I think it depends on how much caffeine you're taking, for sure. I think 1 cup might be okay.
Yeah. Well, on an empty stomach, I'm talking. Yeah. I feel like introducing food or a nut or something before I drink my coffee in the morning.
I introduce an absorption of caffeine in me.
Yes.
But definitely caffeine contributes to anxiety, as a smoking, which hopefully people are not smoking when they're pregnant.
Now let's talk on to sleep, lack of sleep. I mean, we all know that lack of sleep is a form of torture in itself, but how can lack of sleep, birth trauma, breastfeeding challenges all contribute to mental health? And some of these things happen without us really knowing, right?
Yeah, absolutely. So a lack of sleep is inherent to being a parent, and that can initiate or exacerbate existing mental health conditions, for sure. But birth trauma is a big thing.
Yes, for sure.
Because you may be bleeding, you may be in pain, you may have infection, right? And all of these, and you may be scared, right? It could be something serious, and you may be worrying about it could be life-threatening. So you may be worrying about that.
Yeah.
And all of that, of course, can also affect your sleep.
Yeah, sure.
Right? And so birth trauma, sleep, and what did you say? Third thing.
Breastfeeding.
Breastfeeding. We all know how difficult breastfeeding is not for everyone.
No.
And not everyone can do it. Not everyone succeeds. But breastfeeding comes with so many societal expectations, societal norms, what is acceptable, what is not. So much anxiety around it, so much guilt, right? And you can already see it all building up to a mental health issue. Right? So just so much around breastfeeding. It's like you're a bad mother if you don't breastfeed.
You're not.
Seriously.
Yes. That's a lie. People, it's a lie.
Yes. So
we've all felt the pressure of that as well.
All of that contributes to your mental health.
Yeah.
It can affect you may be embarrassed, you may be ashamed. It may affect your intimacy. And it may affect, therefore, your relationship. It may affect bonding with the baby. If you're not able to breastfeed and you're feeling guilty and anxious, it may affect your bonding with the baby. And so overall, it's contributing to the mental illness. Hugely, all of this contributes.
Yeah. I mean, if any partners or friends are listening to this and have loved ones or friends who they are worried about, what are the biggest red flags that we should kind of be looking out for? for people who might be suffering but not talking.
Okay, so mood changes are a big thing. As we said, low mood, feeling anxious, feeling irritable, right? So those are the big three mood changes. Withdrawing from social contact, not wanting to meet up with friends or family, right? Not wanting them to visit. So that can be a big red flag. Not sleep and appetite changes. So sleeping too much, sleeping too little, not eating, and unintentional weight loss, right? Of course, you're going to lose weight, posing energy, but unintentional weight loss, where you're not eating at all. So sleep and appetite changes. And of course, thoughts, all negative thoughts, anxious thoughts, worrying thoughts, intrusive thoughts, all these thoughts. And the biggest red flag, of course, is suicidal ideation.
Yeah.
Feeling suicidal or feeling you want to harm your baby or harm yourself.
I want to circle back to intrusive thoughts. I know we touched on this at the beginning of the conversation. How can we talk down intrusive thoughts? What are your biggest tips in tackling intrusive thoughts? How can we normalize them in our own minds?
So intrusive thoughts are exactly that. They are thoughts.
Yes.
Right? They are not your feelings. They are not your intentions. You're not going to act on them. And they are intrusive. They come unbidden. You don't want them.
You don't invite them.
No. So they come unbidden, right? And they can be images. They may not just be thoughts. They may be images. They may be urges. And like you said, you had some bizarre things, A to Z thoughts, right? It centers a lot on the baby and harming the baby, that you're going to harm the baby in some way. You might drown. What if you left the baby in the bath and the baby drowned?
Yeah.
What if you walked out for a minute and just left? What if you did that, right? And what if you dropped the baby? What if you crashed your car with the baby in it, right? So all these intrusive thoughts are very distressing, right? But they are just that. They are thoughts. And people do not act on that. So that's the first assurance, is that you're not a bad parent because you're thinking these thoughts. When there is too much anxiety, too much overwhelm, this is when you start getting intrusive thoughts.
Okay.
And they're very, very common.
Yeah.
So it's important to do all those things that make you feel better.
Yeah.
If socializing helps you, do that. If exercising helps you, do that. Talking and exploring these thoughts with a professional is always a good thing, but talking to a loved one who you trust, a friend you trust, a family member you trust, is always a good thing, and telling them that you're expressing these thoughts. And then hopefully somebody will have sense and say, yes, these are for don't worry, we're not going to act.
Yeah. That's also
very important to communicate, but very important to seek support, seek help, open up about them, but do not suffer in silence.
No, for sure. The other thing that also really helps me is when my intrusive thoughts and OCD, which I'll get onto at the moment, is when I feel like they get worse when I'm very run down, when I'm putting too much on my plate. So it's always a sign that I'm like, take a big step back.
Yeah.
Rest. Do some massage. Is OCD a byproduct of anxiety, or is anxiety a byproduct of OCD? Do the two come hand in hand? Is OCD quite a common side effect of postpartum depression, anxiety, all the rest?
So OCD used to be classed as an anxiety disorder, but no longer anxiety disorder, but it causes a lot of anxiety. So OCD is obsessive compulsive disorder. And by definition, obsession. So those images, thoughts, urges that I spoke about, those are obsessions. Compulsions are actions. So the need, but not necessarily physical action, but may also be mental actions. So the need to kind of shout out, stop it 3 times.
Yeah.
Right? Or to touch something, or to switch off the light 10 times before or to check the locks.
Yes.
Those are compulsions.
Yes.
So that is obsessive compulsive disorder.
Yes.
Antenatally, it's around within 7% of people.
Okay.
But postnatally, it goes up to 17%.
Wow.
So most of the mental health disorders are around that mark. 1 in 5 women will have it.
Okay.
So around the 20% mark.
Interesting. Yeah, because mine's been knocking doors.
Yeah.
And actually, I remember this stems from a very young age. When I was very young, I think we got robbed, and I think I was in the house. And now when I'm overtired or overstressed or overstimulated, it kicks in. Yeah. And it's always a big trigger for me. And postpartum, every time I think about it, every time. But now I'm quite good at I'm like, no, you've locked the door. I mean, it's not severe enough that it's
Yeah.
But-
But probably you don't need treatment.
No, but I have to, if it gets really bad, it's much easier to give in to the impulsion as opposed to just being like, right, no, stay in bed. If you don't sleep all night, you don't sleep all night, but you are staying in bed. And I've got quite strict with myself now because I know that it's so easy for it to slide downhill and it just take over. And that's the scary thing with any of these things. They can take over so quickly without you even really knowing.
Yeah.
So it's so important to really self-analyze and understand when you do need some help.
Yes. But also to watch, to kind of in your head know what the warning signs
Yes.
are and start doing things to stop it getting worse.
Exactly.
It's very, very important to recognize what we call as a relapse signature.
Yeah. That's so interesting. So as we wrap up today, I wanted to ask if there were 3 key takeaways or 3 things that you wanted mums to know about maternal mental health.
So I think women should educate themselves about what to expect, right, when it comes to mental health.
Yeah.
They should know when and how to seek help, right? I think that is really key.
Yeah.
They should. Yeah, I think these are the 3 things that they need to do: when and how to seek help and know what to expect. Because if you don't know,
Yeah.
you're not going to seek help.
No,
So
exactly.
you suffer. You keep suffering in silence without telling anyone that this is what's happening. So I think and there is help.
Yes.
There is help. I think that is the most important thing. There is help out there. Go
Yeah.
and get it.
Yeah. And I do think the biggest thing for me was just, you're not alone.
Yeah.
I mean, if you speak to any mum about this, they
Yeah.
would have felt one of these things on some level at some
Very
point.
isolated.
Yeah,
Yes.
exactly. And for any mum who is struggling in silence and wants to reach out, where can they come and find you?
Oh, they can come and find me in Mediclinic Parking or in Mediclinic Dubai.
Favorite move.
Yes. So I'm in both those stages. I'm part of the parking cluster. So that's where they find me.
Thank you so much for your time today. It's been so great to catch up. Thank you for my in-person.
Thank you very much for having me.